Good afternoon and welcome back. For those of you who watched yesterday, you know that this is a regular update we'll be giving on hantavirus, bringing you different experts who can talk about this outbreak, particularly because we know there's a lot of interest and it's a very exciting moment now. I guess I don't want to say exciting because it's a very serious situation, but it is one where a lot of people are moving towards Tenerife, where the ship is meant to arrive tomorrow. We have WHO colleagues who are on the ship, in the air, on land, ready to support the passengers and the crew as they disembark, hopefully partly tomorrow, and our expert will talk about that. And our Director General, Dr. Tedros, is also there, so we'll touch on that. We have with us today Dr. Maria Van Kerkhove. She's the Director of the Department of Epidemic and Pandemic Management. You see her in our press conferences talking about these types of issues, these kinds of outbreaks, and we're going to expand a little bit on what you said at the press conference this week, but I want to start with what has happened in the last 24 hours since we briefed yesterday.
Well, thanks for having me, and thanks for your continued interest in this topic. It's great to be able to brief every day so we can give an update on what's actually happening. So since yesterday, quite a lot is actually happening. So as we have said before, there's a lot of planning that's taking place right now. The ship is sailing on its way to the Canary Islands. It should arrive around 5-6 a.m. tomorrow morning. All of that, to be confirmed, but sometime in the early morning. And countries, together with Spain and the Netherlands, are working on a plan to disembark the passengers and to get them home.
You say countries, but it's the WHO who's bringing together a lot of that
guidance.
It
is WHO that is working with countries. It's working with many different countries and many different partners to make this plan actually happen. It's pretty incredible. What we do as WHO, a lot of people hear about us, about guidance, and of course we do that as well. But one of the things that we do with the international health regulations is we bring people together to share information and to ensure that we keep people safe. And part of what we mean by disembarking these passengers and getting them home is about making sure, I'm sure they're very anxious to get home, but to make sure that they do that in the most safe way possible. So the plans that are underway right now, we are working with member states. So WHO is working with member states right now to coordinate the evacuation of the planes. So this is repatriation is what we call it.
So this was the plane. So once the passengers and some crew have disembarked from the ship, they will make it to various planes going to various different destinations.
That's correct. That's correct. So the plan will be that the ship will anchor and that there will be small boats that will take some of the passengers, and it will be done in a very choreographed, coordinated way, in a very protected way. Bring those passengers to shore. There will be a screening that will take place. Right now, there's nobody on board that has any symptoms, including passengers and crew. That's great news.
And we know this, I just wanted to add, because we have a colleague of ours who's on board the ship. We have 2 doctors from the Netherlands who are on board the ship. We have an expert for the European Centers for Disease Control who was there as well. So all these people have boarded the ship in order to be able to speak to the people, be able to speak to the passengers and crew, answer their questions, and also do that health monitoring, as you said.
Yeah, so they're actually performing an incredible role right now. So our WHO colleague on board with ECDC and the 2 Dutch physicians are doing a medical assessment of everybody on board. They're also doing a detailed exposure assessment. What did you do during the cruise? What kind of contact did you have with any of the suspected cases? Just to really understand what risk they may have of getting infected.
Because it's not all the same. So somebody who works in another part of the ship who didn't have a lot of interaction with passengers may be in a different situation from somebody who was a social butterfly, let's say, and met a lot of people, or somebody who professionally needed to see a lot of the people.
Yes, but right now, we as WHO, we classify everybody on board as what we call a high-risk contact. That might sound scary, but it's really it's how we will operationalize the movement of the passengers and the crew safely home.
We're talking about their risk.
We're talking about their risk, yes. So the risk to the general public is low. The risk to the people in the Canary Islands is low. So we do need to continue to contextualize this because of all the attention right now, people may think that the risk is growing. It's not. What we want to do is make sure we're focused right now, and what you and I are talking about, Nika, are the passengers and the crew on board.
So this is a moment, actually, we didn't start with the latest cases, so let's start with that. You said that it's not growing. How do we know that?
Yes. So I'm actually going to look at my slides here because the data is coming in. And again, this is another thing that WHO does. We actually work with all of the member states, all of the countries to receive further information about any of the cases that we're following up, any of the people that might become suspect cases, lab results, et cetera. So I'm looking at the latest on my screen here. And as of right now, we do have 8 cases, 3 deaths, sadly, so far. And some people may have thought we had 9, but actually we discarded one of the cases because the test results have come back negative.
One of the older cases was discarded and a new case was added, so the total remains 8.
The total remains 8, yes. And everything that you've heard prior about the first 2 cases, the patient that's in ICU in South Africa who's doing better, the 3 people who have medevaced, et cetera, all of that stays the same. But it is active, so there's a lot that's ongoing on the ship, and there's a lot that's ongoing in terms of the contact tracing for the people who left the ship in St. Helena, anyone who is on board flying from St. Helena to Joburg. All of those people have been contacted by people from South Africa or their own countries or the ship's operator. And while I have the floor, if I could just thank the ship's operator, the crew, the captain for everything that they're doing in terms of trying to really deal with this scary event, in a dignified way, in a way that's providing information to the passengers. And they've been working with WHO since the start.
I'd say even from the communication side, I've been in touch with the communicator from the operators, and they've asked for what are the next updates you're going to give. They've asked to check numbers with us to make sure we're all aligned and giving the correct numbers and so on. So they really are trying to make sure that they're communicating as clearly as possible.
We appreciate that.
And speaking of communication, an important letter went out today from Dr. Tedros. Can you tell us a bit about that?
Yeah, so Dr. Tedros is on the ground in Spain. He's actually in Madrid. And he will be traveling with high-level officials to the Canary Islands because he, as the leader of the World Health Organization, wants to oversee what's happening. He wrote a letter and he sent it to the people of the Canary Islands. And essentially, if you haven't seen it, I would really encourage you to read it. It's a human letter. It's something he said he doesn't normally communicate with individual communities, but it's basically saying, we understand your concern. We understand that this might be scary. The risk remains low. What will happen with the boat and with the passengers, with the crew, will be done under conditions where it's very controlled. There will be a lot of personal protective equipment. And basically saying, I hear you. Thank you for your solidarity. Thank you for working with us. He thanked the Prime Minister of Spain and thanked the people of the Canary Islands. So it's really a kind letter, I think, that just recognizes that we're all people.
It's kind, but I think also important because people are very concerned, and he's sensing that, and it's not just to be nice, but it's also to reassure people, give them the information they need, and show an openness to answer more questions as well.
That's right. That's right. And I think that's exactly what it does. It says, we hear you, we understand your concern. Here's what we are trying to do to address that concern, and thank you.
And then we're going to wrap up soon, but speaking of addressing concerns, you also briefed other member states. This is something WHO does regularly, especially when there is an event that has this much attention. Member states want to hear directly from us. They don't want it filtered through the media. They want their chance to ask questions as well. So that's exactly what you did today, earlier today, a couple of hours ago.
We did. A couple of hours ago, we held a briefing with member states for the countries who have nationalities on board. For the passengers and the crew. And so what we did is we discussed with them guidance that we have issued for the safe and dignified disembarkment of the passengers and crew. So just high level, what it will happen in the next 24 to 48 hours is that the boat will dock, or the boat will anchor off of the island of the Canary Islands in Tenerife. We are organizing small boats to bring those passengers to shore.
We need that water. We spoke about this earlier.
I'm going to try that again.
At some point, need the water, and then you did.
I'm sorry. Let me try that again. So there will be small boats that will bring the passengers in groups to the dock. There will be a medical screening that will be done. If there's anybody that develops symptoms, anybody that has symptoms, they will immediately go to a medical evacuation plane and be taken to the Netherlands for care. For those who are healthy, those who are doing well, they will go to individual planes that are being organized by countries. Those planes will take those individuals back to home countries.
So there's a couple people from this country, 3 from that country, so it's not separate planes per person, but separate planes per country.
Not separate planes per person, but all of that is actually being organized right now. Some countries will actually put passengers together. The United States and Canada, for example, are discussing sharing a plane. There are some planes that will carry EU passengers. So we're trying to also support the airport in Canary Islands because it's a small airport and not to overload the system. But what we do recommend is the active monitoring and follow-up of all of the passengers and crew who disembark for a 42-day period. That doesn't mean 42 days from now or from tomorrow. It actually means 42 days from the last point of exposure. So that has already started. That clock has already started ticking.
And point of exposure means the last time they had
exposure with a confirmed case or a suspected case, yes. And so WHO is coordinating all of this work, again, with member states, with experts around the world, providing that advice. And of course, the Spanish authorities are doing an incredible job of organizing all of this with the support from the Netherlands and the cruise operator. And so this is, again, dynamic type of situation. And the goal is for all of the repatriation flights to take place on Sunday and Monday. We do know that there's a weather system that's coming in, and I think they want to do all of the repatriation before that comes through.
Yeah.
But again, our Director General is on the ground. We also have a team from WHO that's going to support and oversee with many, many other people.
And I just want to say the different functions as well. So infection prevention and control, we have one colleague going for that, person who specializes in points of entry and especially this kind of movement across borders, an epidemiologist, and then on the boat we had our public health expert at the moment as well.
We do, yes, and that's right. And I think it's a nice point to say this requires a multidisciplinary approach. This requires collaboration, solidarity, cooperation, not just among technical disciplines, but many different countries. And we're really seeing that happen. And I think there's the major attention of the ship, of course, and that's what our priority is. But we are also following up with colleagues in South Africa who are following some of the passengers who were on the plane from St. Helena to Joburg. So there are quite a few different things happening. And before we wrap up, just to say, in addition to all of this, we at WHO, one of the things we've been doing is convening expert networks on clinical care, on infection prevention control, on laboratory. There's a whole lot of work that's happening with the sequences and with epidemiologists to say, what actually happened here? How do we know who infected whom and where did they get exposed? And so that is also underway, very actively underway. And I want to thank even people from Argentina and Chile who have experience with the Andes virus. They're working with us to really understand what's happening here. So it's a really good show of, I think, the leadership role of WHO and the convening power, but more importantly, how everyone is willing and wanting to work with us to really end this outbreak and make sure that there's no further spread.
I mean, it's truly our function. There's no other body that has been tasked with and given the mandate of doing this kind of coordination. You mentioned the international health regulations earlier. If you feel like doing some studying at home, flip through the international health regulations and you'll get a sense of their history and also why they are the document we refer to so often in a situation like this. Thank you, Dr. Maria Van Kerkhove, Director of the Department of Epidemic and Pandemic Management. We will do an update tomorrow as well, we hope. We're looking at who we should have on, where we should have them join us from. However, with so many colleagues in Canary Islands tomorrow as well, you may be getting updates from another source, as in a media briefing or something like that. So we'll see. It's all being determined now to see what's the best way to communicate with the most people and give you the best information in the best format. Thanks so much. Have a good day.